Welcome to Live Younger. I'm Dr. Natasha Iyer with our Director of Medical Education, Dr. Shabnam Daskar. The cornerstone of any longevity or precision medicine program is hormone rebalancing. We cannot age gracefully or with vitality without optimizing hormone levels. We are in fact known and consulted by patients from across the world for our specialty in functional medicine and particularly in bioidentical hormone replacement. So let's talk about what is a hormone, what is a bioidentical hormone, how many types of hormones are there and are they important to you, and what you need to know about longevity and precision medicine.
Oh, that's a lot we're going to cover today, Natasha. So, first of all, what is a hormone? So, hormones are basically chemical messengers in the body, which are produced in one part of the body by specific organs, and they have actions in other parts of the body. But what is interesting is some of these hormones, and there are a whole lot of them, and Natasha, I know you're going to list them.
Well,
Some
not all 26. We're going to talk about the ones that are most
Yeah.
important that we focus on when we're helping our patients. Because over the last 18 years, we've had phenomenal results by focusing on hormone balancing without starting with just a prescription. And that, hormones for us are part of an entire process and program.
Yeah. So hormones are produced in by certain organs, and I was talking about the local production of hormones as well. So for example, the brain has local production of certain hormones like estrogen, progesterone, testosterone, cortisol, and a whole bunch of others, which are called neurosteroids. Neuro meaning nerve tissue. Steroids is the chemical structure. And Dr. Iyer and I were like super excited when we first got to know that all these hormones have these wonderful effects on the brain. And that also ties in to all the things that we see today. Why women have, there are more women living with Alzheimer's disease. It's not just that women live longer. So we'll go down all those routes over over several videos. But the other thing is, Natasha, I know you explained this very beautifully how hormones act like a lock and key and how the receptors work. So I'd
Yes, so Dr. Carr, the first thing is hormones are chemical messengers. They're made in glands. And in the past, that's all we knew. We knew that your ovaries made estrogen, your testicles made testosterone, your adrenal glands made cortisol, and estrogen and testosterone were thought to be sex hormones. I mean, they are sex steroid hormones, but we only thought about them as far as sex drive and vaginal dryness goes. We didn't know 20 years ago how crucial they were for brain health and brain function to prevent disease, even modulate your blood sugar levels and reduce your risk for diabetes, right, through hormone balance, which is why I've always said since we opened the clinic, you age because your hormone levels decline. Your hormone levels do not decline because you're aging, contrary to what's practiced in traditional medical models, right? You're 60 years old, you're supposed to have low estrogen. You're 70 years old, oh, well, you're supposed to have no testosterone. Who cares? Well, we care because we care about vitality and longevity, and we care about doing it right and safely. So we have these chemical messengers that travel after production to the areas and the target cells to where they have their effect. And when I talk about a lock and key, so your cell has receptors for hormones. Consider it the lock, and then consider the hormone the key. And so the key goes into the lock, unlocks it, and says, lower blood sugar level, give me a sex drive, build muscle, make energy, or whatever the effect of the hormone is. And this is part of what we do that's so specific, and I don't bend on this part of the program, and why I never give hormones to anyone on their first visit with me is because we have situations where patients come and they have every symptom of low hormones, but their blood work is normal. right? And we see this especially with thyroid hormones. You know this. People come in and say, I'm not losing weight. My skin's dry. My hair's falling out. I struggle with weight loss. I just feel miserable. I've Googled it. All my symptoms are of low thyroid. I want you to give me low thyroid hormone. And yet, when you look at their blood, they're making thyroid hormone, and so they should not have all these symptoms. In the medical model, it is not recognized that there are hormone receptor blockers and many other things that impact how hormones function. In fact, other hormones affect how some hormones work. And so if these are out of balance, then these may not be very effective. For example, estrogen and thyroid. Estrogen levels affect how your thyroid hormone works, and it affects its results in your body. That being said, we have a lock and a key, but if we have things in the way of the key getting into the lock, we can have normal blood levels of these hormones, but a feeling of being low in the hormone. So I am very particular about how we approach hormone balancing in patients, and we want to do things in a very steady, step-by-step process so that we can balance hormones effectively and safely by addressing all of the different things that affect how hormones are made and work in the body. Because you can make hormones, you might not be making them because you don't have the nutrients and the micronutrients, or something's wrong with the production. So why don't we get your body to produce it? Right? And then if you're unable to produce it, is there anything else that's going to get in the way of the hormones when I give them to you? So a bioidentical hormone is very important to discuss at this point because of safety. A
Mhm.
lot of people seek us out, Dr. Carr, because of our specialty in bioidentical, which means identical to what your own body makes. There are
Yeah.
synthetic hormones, which are
Basically,
pharmaceutical and
I'll just
available.
I'll just define the bioidentical. Sorry, I interrupted you. So many of you may have heard, the bioidentical, compounded bioidentical hormones are not good. They are not controlled by FDA. And Natasha, you're going to talk about that because that is what you've been doing for more than 18 years. So when we say bioidentical, what it means is the chemical structure of the supplemented hormones. For example, in women, if Dr. Iyer writes a prescription for estrogen E2 and E3, the chemical structure of that E2 is the exact one as our bodies make. It's that with age and a lot of factors, we are not making enough of them, and that's why they need to be supplemented. And the same thing, it's not just with estrogen, progesterone, and testosterone being bioidentical. Also, thyroid hormones, you are using bioidentical. The
Right. So the point being that synthetic hormones come from a pharmacy, from the pharmaceutical industry, and they are not identical to what your body makes, meaning that the key is not an exact fit
Mhm.
for the lock. So those are synthetic hormones, and they're freely available by prescription. There are some prescription medicines that are
Yeah.
bioidentical, but they might not fit all of the criteria that we use when we're replacing hormones. Now, because a bioidentical hormone looks exactly like what your body makes, the results you get are wonderful. However, just because it's bioidentical doesn't mean that it's safe and you can just take as much as you want whenever you want. And if you're taking a little and it doesn't work, you can just take more and more and more. We're very particular about how all the hormones work together and how your body metabolizes and gets rid of these hormones, because the metabolites, especially of estrogen and testosterone, when your body breaks it down, there are metabolites that need to be safely excreted. This is where your genetics come into play. This is where your gut health and your microbiome come into play. This is where your liver function and your cytochrome P450 enzymes come into play. We need to understand all of these things to know how is your body going to get rid of these hormones, because some of these metabolites can actually not be safe for you and increase your risk for breast or prostate cancer. And that's not what we signed up to do with you. We're keeping you safe. We're giving you safe, natural hormones. However, each person's body, each person's biochemistry, each person's entire system and how everything is in your body, from your mental health and your stress hormones and your nutrition and your repletion versus how depleted you are, to your gut, liver, all of these other functions, they all affect how hormones are eliminated and balanced in your body. So hormone replacement therapy is not a simple fix. You do not come into the clinic and leave with a prescription. It is a process, and this is why we have programs, not a single visit. Yes, Dr. Kar will consult with you if you're very knowledgeable and if you have worked with a naturopath and you're far along into your journey and you just want to have, Dr. Kar is our medical director of medical education, is very knowledgeable in the latest science. She's going to look at everything with you and she'll give you an opinion on your program that you're on and the journey that you're on. But I insist on doing a program with patients, in that I want to look at everything over a period of 2 to 3 months and establish with certainty that we're doing something that's safe and the results are safe for the long term. So that being said, we've covered what is a hormone. It's a chemical messenger. Everything that happens in your body is directed by hormones. They control every important function in your body. What we see are a lot of people coming in with a whole pile of symptoms that are likely related to low hormone levels, and they're going to the doctor and being told, you're just getting old. So the question is, why do we need hormones? And it's because these things like joint pain and achiness. So not just the things that you think hormones do, irregular cycles, premenstrual, okay, those are obviously hormones. But people who are easily frazzled, people can have anxiety and overwhelm. They can feel
Brain
fatigued
fog,
in the
so
morning, brain
common.
fog, tired and wired, palpitations, blood pressure issues can be from hormone issues. Aging of the skin, thinning of the skin, and loss of elastin and collagen and skin hydration are symptoms of low hormones in men and women both. Weak muscles, restless legs, muscle twitching, these are symptoms of hormone imbalances, but not recognized through the traditional medical model. When you're talking about brain fog, Dr. Kar, how many people come to us and say, my memory is gone, or I can't think like how I used to, and I lose my train of thought, or I'm way more emotional than I used to be. It's not just about hot flashes. I can't have sex. I can't get an erection. I can't keep an erection. Because that's what people think. So testosterone is just all about sex drive and muscle. I'm going to get all big and muscled. But testosterone for men manages blood sugar level and prevents and reverses diabetes and prediabetes in certain circumstances, right? Which brings us to longevity and precision medicine, and why hormones are a critical component, because you can try whatever you want in a man with diabetes or poor glycemic control. But testosterone is the clincher to helping us balance that blood sugar and regulate it. Even mood and feeling joyful. All of these things improve headaches, migraines, belly fat. So anyway, those are just some of the symptoms we see people coming in with. Sleep. Oh my God, poor sleep, non-restorative sleep. How crucial hormones are to restoring sleep. And as you said, they are neurosteroids. So we've now covered some of the atypical symptoms that people can have with declining levels of hormones, and not even just declining. We're seeing patients in their 20s and 30s coming in with symptoms of hormone imbalance because the hormones they have are out of whack with each other. So those patients don't need hormones. They need to rebalance what they have. And if they're not making it, then we help them make it. So now we're going to talk about not all 26 of the hormones that you have,
Thank God.
but we're just going to quickly talk about LH and FSH, which are really important and what we measure when we're measuring hormones for patients, because what you want to know is this a primary issue where your body, your brain is talking? We are trying to understand. Help me say this in an easy to understand method. How do you explain it without diagrams and things?
So basically, and you are talking about both men
LH,
and women.
both men and women, knowing the LH and FSH for primary and secondary hypogonadism.
So before we go into, LH and FSH, first of all, in women, as many of you probably know, that when when you ask your doctor, doctor, am I in menopause? Many of you have probably had an FSH test, and the FSH has come normal, not in the menopausal range, and you're told you're not in menopause, you don't need hormones. So FSH being high is of course one of the factors in that is the way we diagnose menopause, and you have to not have your cycles for about 12 months. But you may be in menopause for, shorter time period of time, but by definition you're not. But the hormonal imbalance, and Dr. Iyer and I have talked about the hormonal imbalance in the perimenopause in a separate video. So that is a unique. So Natasha, you don't realize something, that when a woman like that who's in the perimenopause or the menopausal transition, and she's going through all these symptoms you described just now, weepiness, that was one of my problems, and I didn't know. I am a former OBGY. I didn't know that was a symptom of low progesterone.
I was a resident in obstetrics. I worked in the menopause clinic, Dr. Carr. I delivered babies for 8 years.
I know, I think our
And
brain
I
got
did not
muddled
know
doing
weepiness
that.
was a symptom of hormone imbalance
I
at all.
I know, I had no idea, and you can imagine how ignorant I felt. Anyway, we are digressing. So, FSH, LH may not tell you everything, particularly in the menopausal transition. And in men, so Dr. Iyer talked about something called hypogonadism. So, Natasha, maybe you can explain that a little bit.
So your gonads, I mean,
This
everybody,
is, you're talking
the
about
lay
men
person
now.
calls them nads, right? So,
You're talking
let's
about
talk
men
about your
now.
nads, you guys that are watching. So, your testicles have cells that produce testosterone. And it's not always that a low testosterone is due to your testicles not producing them, but because your brain is not talking to your testicles to tell them. And this is why I insist on a program, because sometimes it's stress and the stress response. Sometimes it's about having the receptors being blocked. And so the first step is not to always just throw testosterone at patients. But let's go on to the rest of the hormones that we like to pay attention to outside of estrogen, progesterone, and testosterone. And one thing to mention for our male clients is that I used to keep their estrogen levels on the lower side, and I used to do a lot of estrogen blockade. But in the last many years, Dr. Carr, as our director of medical education, you've been presenting all these papers and all the literature and the scientific studies now that are talking about how important estrogen is for men's bone health, brain health, heart health, mood, right? So estrogen is not the enemy. It's the metabolites of estrogen that we need to watch to reduce the risk.
Natasha, I'm going to interrupt you there because quite often a lot of men don't know that they make estrogens too. And nature does not design redundancy. And likewise, women make testosterone too. We'll go into all of those in detail later on. But yeah,
Right.
very important not just to look for a man, not just to look at their total testosterone levels. There are so many other players in that game.
But I
And
love that nature does not design redundancy. You should make that a catchphrase, Dr. Carr. I love it because, even when we're talking about diet, I say to patients, look at how we evolved. Look at when man developed a bigger brain and started to be able to communicate and create things. But, that's me on my position on why veganism is not optimal. But let's get
anyway,
back to
we
wrapping
go
up
into
on
that.
the hormones. So, melatonin is a hormone, but it's not necessarily the only hormone of sleep. We know that the neurosteroids and balance of progesterone and estrogen and testosterone are all important for sleep. cortisol affects sleep, thyroid hormone affects sleep. So again, we have a symphony of hormones in the body. But there are hormones that most people will not think about that are very important to us in our practice of functional / longevity / precision medicine practice, right? And so parathyroid hormone, I mean, years ago, when you saw that paper on thyroid stimulating hormone and how important it was for bone and osteoporosis risk, and how too low a TSH being suppressed, which means too high of a thyroid level, can affect bone health and produce osteoporosis as a side
And
effect.
heart health as well.
And that's right. So, a lot of patients come to me and say, my naturopath told me to take this natural hormone and I can just keep taking it until I get side effects. No, no, no. Because sometimes your TSH is suppressed, your free T3 and free T4 are very high, and you have no side effects because the receptor is blocked. And so here you are overdosed, giving yourself a risk for heart arrhythmias and osteoporosis, and you're just taking it because you don't know. So similarly with testosterone, I've had a gentleman come in, his testosterone was more than double of the upper end of normal, and he had no side effects, no oily skin, no acne, no nothing, no, they talk about roid rage, none of that. And it was because he was so out of balance with so many other things. And he was shocked that he felt better through the process after, and we got him back to a normal testosterone level. We're not about overdosing. So other hormones like growth hormone, oxytocin, prolactin, these are things that we also have to look at when we're looking for a precision medicine-based longevity program for patients to live younger.
Yeah.
So, we need hormones. We need to balance hormones if we want to live younger. That is what gives us our vitality. That is what gives us our youthful function. So thanks, Dr. Kar. In conclusion, what it is that you age because your hormone levels decline. The world is so sick and toxic today that people are losing their hormone production and balance at younger and younger ages. As I said, we've got patients in their 20s and 30s seeing us because they feel so old and they know something's wrong and no one can help them. So for healthy aging and vitality, everything needs to be in good balance. So I thank you for your attention. I hope this was useful to you to understand how we approach longevity, precision medicine, with a functional medicine foundation, and hormones being the most critical part of your whole process and program.
Thank you.
Dr. Kar, a lot of patients, and in fact, a lot of physicians in the field of longevity medicine, Peter Attia is hugely critical of